Welcome to the For Health's Sake podcast, brought to you by Edito Health, elevating digital transformation with a human touch. This episode is sponsored by Radical Health Festival. It's critical to be radical.
Hello and welcome to this episode of For Health's Sake. And today I have Dr. Ilse Rauhaniemi, who is the head of occupational health from Terveystalo, which is a Finnish organization. And she's coming all the way from Turku. So welcome, Ilse. And it's an absolute delight to have an opportunity to have a chat with you today. But let's start by describing what Terveystalo is, because a lot of the people who will listen to this may not necessarily have heard of it, even though it's actually quite a big organization.
Yeah, well, I'm the head of occupational health processes in Terveystalo, which is it has the largest network of clinics, private clinics in Finland, quite a big player in Europe. Also, I think the fifth biggest player in Europe, or sixth. I'm not sure, but I think fifth or sixth biggest.
So it's a big organization, but what does it provide? What does Terveystalo provide?
I think we are a very big player in occupational healthcare. We have over 700,000 Finns working age people under our occupational health care. Also, we have other areas, of course, like surgery and everything, like every private clinic has.
I mean, this is an enormous number, because 700,000, basically 1 in 7 Finns,
yes,
is part of Terveystalo. So yeah. This is an enormous number of people. This is really quite a large, in other words, this is a large institution, and you're dealing with a large population of adults, people in working age, and that sort of frames this population. So, in essence, you provide, I assume, occupational health services to them, but you've entered into a really quite exciting initiative with Nightingale Health.
Yeah.
I really want to hear about this initiative, because in many respects, you're breaking new ground here globally. And this, considering this way of thinking around prevention is going to become the norm for everybody soon enough, it's very important we understand this. So could you describe how the relationship works and what you're doing with Nightingale Health?
Yeah. At the beginning of this year, we have renewed our occupational health checks, and it's the partnership with Nightingale, which has it has given us the opportunity to do this, and we have renewed our health check lab packages, and it's something totally new, and I think this is what you meant when you asked me here to talk about this. Our aim is to shift the focus more and more towards this preventive healthcare, because we know the people globally, the people is aging. We have this aging thing going, and we also have we don't have enough people working in healthcare, so we need to do this if we want to take care of people.
Oh yes, I mean, this is happening all over the world, but in Finland perhaps a little bit more, because you're aging a little bit more rapidly in Finland than in other parts of Europe.
And this partnership helps us to shift the focus to preventive care, because now we are having much more information in our health checks. We will see, we will have the risk assessment for these lifestyle diseases, 8 major lifestyle diseases with this laboratory tests we have now put in our health checks.
Okay. So could you describe to me what the new risk report will show that you'll be getting?
Okay. We have these traditional lab tests, maybe I can tell you, I have some things here. I can tell you what we have in these. We have these like normal things we usually use in health checks. They are those normal lab tests like cholesterol levels and total blood count and you know these like long-term blood sugar and creatinine and liver values and so on, and also BPETs and those TSH and so on. But now we have also this risk assessment, which includes 8 lifestyle disease risks, and 6 of them are for all. It's heart attack, it's CV risk, cardiovascular risk,
Yes.
type 2 diabetes, liver fibrosis and cirrhosis, chronic kidney disease, and alcoholic liver diseases. But those who smoke traditional cigarettes, we also have the risk of lung cancer and COPD, and we have the risk to get these diseases within 10 years. But also we have the risk compared to the group of your age and your biological sex. So we can very early given we can help the people in very early stages with these things.
Now, this is a big advance to where we were before. I mean, in some cases, in, say, cardiovascular disease, we were already using things like Q-risk, and there are various calculations. But for a lot of these things, you need a calculator. You need, it's quite an involved process because, of course, each of them has its own parameters. Plus, for some others, we didn't really have a good way of determining risk. A typical example, I think, is alcoholic liver disease, where by the time you got the changes, it was far too late to do anything. You were basically, your liver was failed by the time you got the changes. So these are a big change.
It's it's a huge thing because we had to use these different methods which took a long time, and we know the doctors didn't have time to do this. So now we have one blood sample, and for the customer, the thing is like business as usual. They go to the lab and we cut the results. And from one blood sample, we have the risk for all these diseases. And we only took those diseases we had before this medically accepted way to calculate the risk. And also we thought that they have to be the diseases people can change the risk. They can do things.
They can reduce their risk.
Get lower with the risks if they change the way to eat and maybe sleep better or do some exercise and
So we'll come to that in a second, because in essence, you'll be using the tests in different ways. But at the moment, what you'll get now is a single report, which will give a clinician a pattern of where the risks are highest for each individual. This is enormously useful because, for example, if when you saw me as one of your clients, you then tell me, Charles, you're at high risk of developing type 2 diabetes and also liver fibrosis and cirrhosis. You then can also help me by assisting me and sending me to the right place and doing the right things to reduce that risk, like we do for all non-communicable diseases.
We have this very visual PDF report where the patient or the customer can see the results very easily. It's very easy to understandable formats. You just see the pictures and you can realize what is the risk and how does it it gets better if you change your lifestyle. So it's very, you can use the time with the customer to the conversation. You don't have to use calculators and look at the computer. You can talk and have this it's like an interview or conversation.
Yes.
Motivational methods you can use. You can hear what the patient has or customer has in her or his mind, what to do with her or his life.
So you then start to use behavioral health techniques to assist an individual, I assume.
Yes.
So talk to me through what happens. You've got the result now.
Yeah.
What happens then? Treat me as your patient now.
Yeah. When the results are in, the customer meets the occupational nurse. You know this occupational health care nurse, and they have this conversation together, and the nurse uses these motivational techniques, and if necessary, the nurse refers the client to other specialists like nutritionist or psychologist or physiotherapist or whatever. We in Terveystalo we rely in multi-professional team because we don't have so many doctors in Finland or all over the world. We don't have enough doctors. We use different professionals to help the customer, and it's the one key point with this our new method.
So if I am high risk for one or two conditions, clearly at some point you'll want to see me again.
Of course, yes.
It's and when you do, I assume you'll want to do the test again to see if there's any change in my risk.
Yeah, the nurse works as like a case manager.
Yeah.
She or he refers the customer to these professionals. To doctor, of course, if there are more than one elevated risks or there is a high risk, of course, to the doctor then, or if the risks are a bit lower, to these other professionals. But then the patient or the customer comes back, and we have a new test, so we can see within 3 months we can see the results, and it's amazing because the problem with these lifestyle changes are that the people people don't carry on with these. It's very, very, very difficult to keep the new way of life. It's not easy, but if you see the results, you can measure, and we can motivate much more easily than before.
It's because amazing. You can see if there's improvement, if there's deterioration.
Yeah.
You can plan far better for an individual because you can see their risks either increase, decrease.
Yeah.
And you can manage that very, very well.
Yeah.
And of course, this is the new way of working because this is where healthcare is going all over the world. We have to manage prevention far better than we do at the moment. So we would expect, and the issue is always, how long will it be before we see a change in outcomes? Because of course, at the end of the day, that's what we all want to see, isn't it? So one would expect to see something in a year or so, I would assume.
Yeah, I think it's so nice because we can see the results within 3 months, and I think it's possible to take it even in shorter time. Maybe in 1 month we could see some changes, but we think 3 months is better because we assume that people keep on going if time is a bit longer. But the nurse calls the customer and asks if he or she has kept going. So we know that it's now a good time to take a new test. If not, we can motivate the customer. Please go on, do this, and then we ask her or him to come and take a new test.
So logistically, this is actually quite a big operation because
and we have to work a lot also with our professionals. This is so modern technology that they have to also change their attitude to think to realize the key point here. But now we are in a good mood. We are going well. It took some months to take this new attitude, but now I think it's going very well, and we are thrilled to see the results. What we have been doing, it's amazing.
So this is good news. How difficult was it to speak to the health professionals for them to accept this new way of working?
It wasn't easy. I must be honest. It wasn't easy, but with this Nightingale analysis, we have over 450 peer-reviewed scientific articles. We can show really it's reliable, and when we can show the results, it's easier to work with our professionals.
Oh yes. And mind you, since you started, there's been significant change. Now, Kaiser Permanente are using it in the United States. Cornellville is where the lab is, up in the East Coast of the United States. These are very renowned, big, and very well-respected academic organizations and institutions. So I'm not talking about the science, because I think you're right. You really need the science behind you. I'm talking more about getting the health professionals to change their behavior, to accept that their way of working needs to change. How difficult was that?
The doctors are very keen on diagnostics and also taking care of illnesses. So we have to tell them that this is social importance in this way of doing things, because we know we have to do this, because if we don't do this, we won't be able to take care of people. And we have been talking very much about this, that this has an importance to the individual customer, because it makes her or his life better. But also the employee, because the person with healthy lifestyle, he or she is much more productive, and it's good for the company. But also the social importance is very, very, very big issue here. We have to do this. And I think when we talk with our doctors or our other professionals, they realize that we have to change the way of working.
I mean, it's easy to actually have the conversation with them around the change. What is more difficult is getting people to accept the change in the way they work. We're all the same. We like doing what we're used to doing. Change can often be a little bit of a threat. But clearly, you've worked on that.
We have made it now so easy, because we have this report, we have these pictures. It's so easy for the professionals and also easy for the customer, of course. And in this report, we also have one page which tells very detailed information about these pictures. So every time the professional meets the customer, he can use also this explanation page of this report, and he or she, also the professional, is learning every time, and it's easier and easier every day, and it helps also them to accept the new way of working.
I mean, the implications of this are enormous, because, of course, as you get used to doing this, you'll realize that certain methods of managing risk are better than others. We'll all learn together over the coming months and years. But you've mentioned two really, really important things, and I just want to repeat them, because they're really important, I think. In terms of working with health professionals, the things which really, really would drive that change of behavior are the fact you've made it easy.
Yeah, that's
in other words, in many respects, it's easier to work with this technology than not to work with this technology. So the default becomes the easy way.
Yeah.
And secondly, you're using a lot of visual tools to assist the conversation between the health professional and the citizen, the patient, the client.
And the report is
really important.
Yeah, and it's always available for the customer in the app and also in Terveystalo online services. The customer can always go back and look at the report. Oh, I can understand that. They can also read this explanation page by themselves, and they can ask an appointment with the nurse. Can you please tell me more about this? They can always go back to the results. And I think the employees are also quite thrilled to see the results, because these lifestyle diseases are strongly linked to those diseases that cause the biggest volume of work absences.
Yeah.
If you can understand my English here.
Yes, absolutely.
Like musculoskeletal disorders or like mental illnesses, which are the main causes of work absence in Finland, and also I think all over
the world, actually.
And it's so amazing, and I think doctors in occupational healthcare are very they want to do things also for the organization, because we are a lot of we want to work with the organizations too, and we can give a group level picture about their employees, how they are going, and what shall we do in the future so their employees are productive and energetic and doing money, of course, for the company also.
Yeah. So one aspires, the real aspiration now, the hope is that you'll be publishing something showing the results of this over the next 6 months or so. One would hope we'll start seeing something.
This collaboration will provide us so amazing data. It's really important. I think it was about 10 weeks we had 30,000 samples, and it was first 10 weeks. So you can imagine in 6 months
we will have absolutely enormous.
And it's not retrospective data we have. We will have data which tells us about the healthcare needs of our future elderly people, and also the risk of getting ill of this working age population. So it's really amazing data, and we are really eager to see the results. First of all, we realize some phenomena, but after months and maybe 1 year, we can also see the results of this lifestyle changes our customers are going to do, or so it's amazing.
So thank you very much.
Thank you,
Ilse, for an opportunity to start the discussion around what's actually happening, because in many respects, this is the first example of us using new technology at very large scale.
Yeah.
We have used it, scientifically, we have examined samples, but using it in day-to-day practice in world medicine, which is really what we're describing now, you are the first, I think, in terms of scale.
And we are quite a big player. We are going to have this data quite soon, and I think this is globally interesting thing, and I think maybe we can give the results to everyone, so they all of the healthcare clinics want to do this in future. I hope so, really, because it's so important.
I think very clearly we're of the same mind here. I agree with you. It's extremely important.
And I think
is the future. And I think the message from today's little conversation we had is that we will be having further conversations when you have some more data for us to discuss and to design and to look at what worked and what could work even better in the future. So thank you very, very much for taking the time to have this short conversation with me. And we see each other at the Radical Health Festival in Helsinki.
Yes, I'm so happy to be there because this is something I want to tell everybody.
Thank you, and we'll help you do that.
Yeah,
Thank you very much, Ilse.
Bye.
Bye.
See you.